Measles is a highly contagious respiratory virus. It can cause serious health complications, especially for children. The countdown to school spring break is now less than 2 weeks away. As you make plans, you should also double check that you and your family are up to date on vaccinations.
Perhaps you've been hearing in the news about cases and outbreaks nationwide.
That's Beacon pediatrician Dr. Shanna Kautzman.
Let's talk about measles. So measles is a virus.
Measles is a concern this year. Cases have exploded in 17 states across the U.S. as health officials warn people to take precautions.
The measles vaccine is safe and effective and really the best way to protect your child and to protect our community.
According to the CDC, measles is a disease caused by a highly contagious virus. It can spread through the air. Measles can cause severe flu and cold-like symptoms and a rash. Some people who become sick can have life-threatening symptoms.
It can have serious complications like swelling of the brain and pneumonia. About 1 in 5 people are hospitalized, and about 1 to 3 of 1,000 people infected with measles can actually die from it.
The CDC says in the U.S., most measles cases occur among unvaccinated people who get infected outside the U.S. and then spread it to people in the U.S. who are not fully vaccinated.
And St. Joseph County does have a higher percentage of children who've completed that MMR series, and we haven't had a case here locally. So the concern to our community is low.
According to the St. Joseph County Health Department, while the risk to the community is low, there are still concerns for people who are unvaccinated, especially as spring break travel picks up.
That risk still is low, unless I was a school who had a high volume of kids unvaccinated. Then I'd be probably a little bit more concerned because it only takes 1 before it's 10.
In Indiana, there's been 1 case of measles reported in nearby Lake County. In Michigan, 3 cases have been reported. All of those cases prompted health officials to push schools and healthcare providers to be on the lookout.
That's why when we first saw in the case in Lake County, our big push was to local providers to say, hey, this popped up, it's not too far from us. Don't let these symptoms go away. If this individual is not vaccinated, think, is this measles?
Schools are also required to report any vaccine preventable sickness like measles, and any children enrolled in school must be up to date on their immunizations or have filed a waiver.
Indiana is very specific in the law regarding school vaccination requirements.
Health officials say if you and your child are fully immunized, your risk is extremely low. If not, now is the time to get caught up. The MMR vaccine is usually given in 2 doses and takes about 2 weeks to become fully protected. Not everyone is able to get the MMR vaccine, which means if you are able to get it, you can protect the vulnerable from being exposed. Contact your doctor or health department to learn more about how to make sure you and your children are protected. In the studio, Kristen Bean, WSBT 22 News.
Thanks for watching. Like and subscribe to the WSBT 22 YouTube channel.